So folks, I am here with one of my longtime friends. Happens to be a fanatic elk hunter with his, you shooting a recurve or a longbow these days, Bill?
Recurve.
Recurve. Traditional archer, Dr. Bill Wilshire, who is a foot doctor, who has saved so many problems for me. You're the only guy I know who fly fishes for muskies, pike, anything and everything. You're like the ninja of the southwest Montana mountains, sneaking around, shooting elk. He's Mr. Modesty also. But appreciate you being here.
Glad to be here.
Yeah.
Thank you guys for having me.
Yeah. Bill and I did a podcast last summer, and it was one of our best podcasts as far as downloads and shares. And so I called Bill. I'm like, hey, you know all those things we talked about on the podcast? We ought to do that in a video. So right here, you're going to have to bear with me here. We got some antlers that we use whenever we have props. So this buck, he wasn't symmetrical, so it got a little bit of bad angle to it. But Bill said he's going to use some of his props here, this chart, to show a few things. He brought a Fred Flintstone foot like I have. What is that, Bill?
That's just a loose floppy
A loose
skeleton, that we can kind of move around and show different foot posture.
All right. So the first thing we're going to cover in my notes here is the architecture of the foot and how that impacts everything we're going to talk about today. And I tell people when they say, what's the most important thing for an elk hunt? Well, it kind of starts at the ground, your feet, and whatever takes care of your feet. So I've been to your clinic and you've taken care of a lot of foot problems for me. Let's walk through just kind of the biomechanics of what a foot is supposed to do and how it works. I think that diagram there usually handles that.
Yep. In a foot clinic in general, probably 90% of what we see, especially in a town like this where everybody's just active in all kinds of different pursuits, 90% of our patients have biomechanical overuse injuries. And so it ends up how we really focus on evaluating the foot from the beginning. If you drop a bowling ball on your foot, that's a bowling ball injury. And that has nothing to do with your high arch, your flat foot. If you sprain your ankle, that could have something to do with your structure, but it's a sprained ankle and it's a trauma. But by far and away, most people come in with long-term progressive nagging problems that show up without trauma and start to manifest and become chronic. And sometimes they have to be addressed with surgery. Sometimes they get out of position so far that there's no other way to address it. But by far and away, if you're adept at manipulating the skeleton, offloading bones, controlling motion in joints, even in arthritis and not just joint contractures, but arthritis problems, we can control enough motion to make a foot better and keep people out of the operating room or stop progressive problems or at least decrease pain.
So when you say overuse, you're talking about some knothead like me who hikes too much, or someone who skis too much, or a runner, or is that when you're saying overuse?
Yep, repetitive overuse is how a lot of these things happen. Whether the foot's grossly out of position, and then so the bones and joints are out of position, and you're using them out of position, thousands and thousands of times with your normal load, let alone carrying up, say, a hunting pack or carrying some game out, or a normal foot that just gets abused from, you can defy the physics of anything. You can overuse any soft tissue or any joint or any bone or any structure. So the underlying architecture plays in 90%, I would say, of foot problems that we see. Just yesterday in clinic, I had a short day. I probably had 17 patients, and fully 14 of them, I was monkeying around with the position of their foot and, which joints are out of alignment and where's the wear and tear and is the tendon tight, is the muscle too dominant, and how to get underneath that foot and manipulate it so that it can defy gravity in a better way and not move out of position and not wear structures out. Or some of it's just as simple as offloading bones that are prominent. Say you have a a hammer toe where your toes are contracted. A lot of people have subtle hammer toes. Some people have severe hammer toes, and that creates overload. And a lot of times we're just, I think I had 5 patients of those 17 patients yesterday that had overload issues in the ball of their foot.
Really?
Yeah, just from walking around town. Half of them were hunters, half of them were runners, hikers. You know, everybody's out in the woods these days. So that's a big part of foot world in general, and it translates. I think in this. A couple conversations this week about people with chronic knee pain, people that might have been through knee arthroscopy procedures or total joint replacement or have chronic knee pain in certain sports or certain activities, and we do look down at their foot, and it isn't always that the foot is the cause for the knee, but frequently it is.
Really?
And it's just like building a house on a crappy foundation. Over time, gravity wins. Things are going to move to those low points of support or whatever. And so if you have an imbalanced foundation in your house, then things move erratically over time and things wear out. And your body wears out anyway with age, but certainly the abnormal foot position, abnormal foot posture, and abnormal biomechanics, motion, structure, function is what allows a lot of that stuff to happen.
So if you show the camera how this is supposed to work in can we say, is there such thing as a normal foot?
There is. I don't get to see a ton in my office. Mostly what we see are variants or gradations away from normal that create overuse problems. Like if you have a normal architecture and even with increased activity, as long as your bones and joints, your structures, your ligaments, your tendons are used to that load, they've been buffed up over time, and the foot's just moving in its normal, subtle way, you're less likely to get an overuse problem. Okay. So if you have a mild flat foot, you're less likely to get a problem than someone, obviously, that has a moderate or severe flat foot. And it's the same reason you won't see, like watching the Olympics right now, you're just not going to see people out there with these terrible paddle feet, flat feet. They don't make it to that level. You know, they're not going to get there. They're going to succumb to overuse over time.
Okay.
And so I would say that it'd be more likely in some of these, say, track people that are just pounding on their feet in the Olympics, be more likely to see a high arch foot out there, and very unlikely to see a flat foot. But more likely than not, most of those people have pretty dang good architecture that they're able to pound their body like that.
Right.
What we primarily look at, I mean, there are a lot of variables here, like that you could have bow legs or knock knees, and that has a big impact on gravity pushing down through the leg into the foot. But in my specialty, we tend to look at the ground up, and we do consider those angulations in the legs. But more we're focused, in my specialty anyway, focused on the subtalar joint, this big joint below the ankle. The ankle only goes really up and down, fore and aft. The subtalar joint is a much more complex joint. It has 3 joint surfaces in it that fall off at different angles, one little one here, and one here, and they all fall off at different angles, and they allow pretty significantly restricted motion back there. And even in a normal foot, the motion's minimal degrees of motion, 6, 8, 10, 12 degrees of total range of motion in the subtalar joint is normal. And so if you have a flat foot and you go, 5 degrees out of position, that's a ton of degrees out of position. So it's subtle, but it matters. And then the other joint that we really look at in the rear foot anyway, in terms of biomechanics, is what's called the Mid Tarsal Joint. The talus is the bone that forms the ankle joint and then forms the subtalar joint. And then the talus and the navicular and the calcaneus, the heel bone, and the cuboid bone form that mid-tarsal joint. And between the subtalar joint, goes all the way around, and the mid-tarsal joint is where your foot goes through these critical shock absorption motions and adaptation motions of what's called pronation, which is when your foot rolls in, like, say, towards a flat foot.
So if this is my right foot, it rolls in this way.
Yep. It's a complex, all 3 body planes of
X, Y, and Z.
Yep, are all moving in the subtalar joint and the mid-tarsal joint. So there's significant complexity to it. But what it simply translates to is, do you have a normal architecture, and does that foot move normally and stop and lock normally? Or does it not move enough? It's not as good of a shock absorber. That's like a high arch architecture. And then if you have an extreme high arch, you're more likely doomed for problems associated with the severity of the abnormal architecture that way. And if you have a severe flat foot, you're much more likely to have things move out of position. So pronation is normal. Pronation is as you load your foot up as you're walking, that foot rolls in slowly, but it's supposed to stop and lock. So everybody should pronate a certain amount, and it's imperative for shock absorption. That's how you shock absorb. Yeah, the fat pad on the bottom of the heel helps with shock. Yeah, the fat pad on the under the forefoot helps with shock, but that's not your primary shock absorption. It's pronation that absorbs shock.
And then over in the really slow motion of that, then the tendons and soft tissues are what absorb a lot of that.
They do.
Stop.
Right. There's like a shock load into tendons, and there's a dynamic resistance to motion as the muscles are firing. They're pulling up, and gravity's pushing down, and so there's a balance. And if everything works perfectly, you don't get injuries. The ligaments are really not supposed to be shock absorbers. The ligaments are little belts, little straps that don't have muscles within them. They're just like a strap. You'd almost staple it here to here. Their function is to kind of help with end range of motion. So if your joints are going through normal motion, the ligaments have just this little end point of, okay, you're not going any further. If your foot's moving out of position, your ligaments are getting strained.
Right.
The joint just keeps stretching.
Right.
And over time, the ligaments, like tendons, will stretch and give way. So there's commonly, I hear people talk about, some physical therapists, chiropractors who are working on helping people get better, talk about strengthening muscles, say to defy a flat foot.
Right.
No way. It doesn't work. The muscle that's been trying to hold your flat foot up for your whole life, since you were 1 year old and walking, and your joints have been moving out of position, that muscle's just been lifting weights the whole time. It isn't a weak muscle that allows the arch to collapse. Further, that muscle's probably over-dominant, but failing through its tendon, because the tendon, just like you can stretch your Achilles tendon, the tendon will give way over time. It's called attenuation, and that can create tendon disease, tendinitis and tendinosis, which we can talk about if we get into that. But anyway, these soft tissue structures will fail over time if the structure's moving out of position, if you challenge it enough for long enough. So when you're walking down the trail, it's normal to heel strike on the outside third of your heel, and a high arch foot.
Outside third.
Yep. And a high arch foot can accentuate that, and it can be a problem, but it's normal to wear that. Even people with flat feet, most of them hit on the outside. Okay. And then as they forefoot load and their knees come up over their foot and they're pushing up the trail, that foot is pronating, and then it should stop and lock in this real nice stiff architecture position, so that now the tendons can pull through a stiff structure. In a flat foot, if that foot goes past that lock position, which we call neutral position, or the mid tarsal joint locks up solid, and the subtalar joint's in this what we call neutral position. If it goes past that, all kinds of things are happening in different body planes. The talus is in an overpronating or a flat foot. The talus moves forward, spins in, and tips down. And if the talus is doing that, it's affecting the subtalar joint. If the talus is doing that, it's affecting the ankle joint. If the talus is doing that, it's affecting the talonavicular and calcaneocuboid joints. So everything's moving out of position, and that's going to create strain on ligaments, tendons. It's going to create instability, imbalance. It creates abnormal gravitational forces over decades of life through your foot. And your muscles are trying to fight that and hold that foot in position because it's a loosey-goose foot on the ground. It's not a good structure. And then that predisposes you to tendinitis, bursitis, fasciitis, all the itises that occur in the foot. And then further, over 10 and 20 and 30 years, if you have the correct or the abnormal foot type that would allow you to develop this, things like bunions, where the big toe goes towards Butte and the metatarsal goes towards Billings, it happens because the foot's out of position and tendons are pulling and other tendons are getting beat up and they can't do their job. So all the soft tissues are functioning out of balance, so to speak. So to get a bunion deformity, you have to have instability here, and that whole bone just slowly tips that way in 10, 20, 30, 40 years. And this goes this way, the toe goes this way, and you end up with wear and tear, osteoarthritis that, over time could start to hurt, could lead to surgery, but certainly causes a wider foot, boot fit issues, So those are just subtleties. Also, that same foot that overpronates is a classic foot to develop hammer toe deformity and contractures, because the tendons from up in the back of the leg, behind the leg here, that come down to the bottom of the foot and split off and pull your toes down to help push you forward. Those tendons are doing double time work, trying to hold that rear foot still. It's just moving all over the place. And so the tendons start to grip and grip and grip. And if you do that for 30 years, you're going to get contractures. And that creates more and different imbalances and problems, pain, blisters, overload on bones and joints, sometimes osteoarthritis in the outside of the foot, but usually it's the big toe joint we're focused on in terms of arthritis.
Yeah.
So in a nutshell, pronation is from heel contact to pronating, locking in a normal foot, forefoot loading when that forefoot's bearing full load, and then the Achilles tendon fires to pick you up and go your next step. If it's normal, the foot can defy, if your body's ready for it, a 30-pound or a 50-pound pack or an 80-pound quarter, and miles and miles, if your structure's been buffed up and you properly prepped, for that kind of activity. If not, even a normal foot, you can just beat something up too much one day. Go out, don't get your ligaments, tendons, and joints ready. Even a normal foot can certainly show up with problems that, kind of out of nowhere.
Yeah.
But a flat foot, worse, and a high arch foot, worse. And every gradation away from a normal architecture to severe flat or to severe high arch and severe flat foot creates trouble, usually.
What we see on the outside of the boot is this hits on the outside third, it rolls forward, and does that.
Yep.
So
this is a right foot skeleton. So you hit on the outside, your foot is supinated. It's kind of in a high arched position and tipped outward. And then as your forefoot loads up to the ground, your subtalar joint and the mid tarsal joints are slowly rolling in, or it's not that slow, it happens in milliseconds, but slowly rolling in. It should stop and lock in these joints to allow that foot to be super stable. All these joints are set up as flat joints in the arch, like a brick arch over a door could handle a super heavy load. These are triangular bones with flat joints that are not set up for motion. And so once you load those up, if everything behind here is behaving, these guys have a free ride to just lock everything up and defy gravity and hold the arch up off the ground. And so you pronate, should stop and lock. If you overpronate a flat foot or an overpronating foot, you roll in too far and overload the foot in a different way. But in a normal foot, you pronate, stop and lock. Heel comes off the ground as the Achilles fires to push you through, and then you resupinate at toe off and then swing through your gait stride and hit again on the outside. That's normal function. Even, like I said, flat feet that want to be in that position, inward rolling, still most of those people heel strike on the outside. If you have other issues associated, like severe flat foot or osteoarthritis or other congenital conditions that lock up joint motion back there, some people hit on the inside, they're just going to have trouble.
Right.
You can generically say that a flat foot causes inside foot problems, inside ankle, inside knee, inside hip. Doesn't have to work that way. A flat foot over here can cause problems on the other side. But locally in that limb, that flat foot, it generally shows up that way. And you can also, the converse is true with high arch, outside foot, outside ankle, outside knee, outside hip.
What percentage of people, not your patients, but just people out there, is there anything that says that, X percentage of people actually have bad foot architecture and they just don't know it?
Well, if you're adept at picking this stuff apart, you can go to the mall and watch. And people watch. How does a foot move and how's a leg move? And does that person have a tight Achilles tendon? Does that person have a flat foot? Do they have a high arch? You can pick that stuff up even in shoe gear. And when you're really critically looking at it, you could pick on anyone's foot architecture. And I don't know, I bet I've never seen any literature on how many people have normal architecture versus abnormal architecture, but I bet it's not more than 30% of the people in this world that have perfect architecture, and it might be less than that.
Really?
Yeah.
So.
But you get away with a lot of people get away with subtle abnormalities their whole life without any pain or problems.
Right.
So it's not that it's going to show itself.
When I decided I wanted to be a backpack elk hunter, I started having all kinds of foot problems. And then I started having all kinds of back problems. And when I was younger, there's a tendon that comes around here and attaches. I pulled that off the inside of my foot. I detached it. It's posterior tibial tendon.
Yep.
Is that what it is?
Yep, right here. Insert. It comes. It's the first muscle. You can barely see the tendon of it here because it's buried by these other muscles. But it's a really important muscle tendon complex, and the tendon of it here comes around the inside. It's the first tendon behind the ankle bone. It uses that ankle bone as a pulley, turns the corner, and inserts right there. And it's trying to control that. In a flat foot, this is going this way.
Yeah.
And it's doing everything it can to pull right off this knob here to not let that happen.
Right.
So it's going like that. And it's also trying to pull backwards and actually pull your arch up and hold it up.
Yeah.
Even in a normal foot, it's an important muscle, but it gets strained in a flat foot.
So when that snapped, all of a sudden I had a knot down on the side of my foot about that long. And they went in and surgically repaired it, and this was 1982.
Yep.
And when I saw you, 15 years later for my foot and back problems, you said, "What happened here?" And I tried to explain it to you, and you just said, "Flat feet problems."
Yep.
So you've helped me with a lot of flat foot issues.
I would say that's the one tendon for sure in a flat foot that has a tendency towards abuse and failure, is the posterior tibial. It's just doing so much work, and it's defying gravity. It's a push-off tendon like the Achilles is. It also is a secondary function to pick your heel up and push you forward because it's using this as a pulley here.
Okay.
It's trying to pull back and hold your arch up off the ground. It's also in a flat foot trying to keep that foot from splaying out. Mm-hmm. A certain percentage, I don't really know what the percentage is. I'll bet it's 30% roughly of people that have a flat foot have an extra bone right there. It's common enough. It's a common enough bone to have a name. Os tibial externum. It can be like a lima bean size bone. I've seen them bigger and smaller than that. That can affect the insertion of the tendon. It's right at the end of the tendon, right before it inserts into that knob of bone there. If you have a rock in there, it's not supposed to be there. You can get away with that your whole life. But if there's a ton of strain on that tendon insertion and it's wrapping around a rock to insert, it can weaken it. Yeah. And so you can have problems there. So maybe 30% of flat feet, folks with flat feet would have that. But that tendon at its insertion and where it turns this corner, goes through this groove, comes right off the back of the tibia. So it's got a ton of heavy duty anchor point up here to really pull. Just like if you put a rope around a tree, where's the rope going to break? In its excursion around the tree, there's a lot of friction and pressure there in a flat foot, and there's more complexity to it as the leg rotates in pronation too, not just the foot. But that tendon can just get the tar beat out of it and be a major problem. I mean, if you developed acute posterior tibial tendonitis in the backcountry,
which I have,
yeah, it's devastating. I mean, you can maybe gimp out on the side and back of your foot, but that could shut you down for sure.
Yeah. What other kind of common foot architecture problems happen where people should be thinking about this when they decide, I want to be hiking 10, 12 miles a day in the mountains with heavy loads chasing elk? That might weigh into some of the things we'll get into about orthotics, about other mechanical devices, or they're just how they get their boot fit.
It's primarily, high arch and flat foot and normal foot and gradations away from normal. But what's true to say is all the forces that you impart on your body every day are dynamic forces, right? Gravity. Carry a 5-pound grocery bag, it's 5 more pounds. Carry a 30-pound pack, it's 30 more pounds. And these tissues are all dynamically, the bone, the ligament, the tendon, every tissue in your body, even cartilage, is trying to repair itself all the time, just like your skin is, constantly going through cellular repair. The norm is you're straining your tissues all day, every day, and they're repairing themselves, and you're just fine. But when you start to defy the physics of these structures, they can't keep up. And so things start to happen. They start laying down scar tissue, or they get inflamed to stop you from using the part, or they're starting to fail. I think a primary thing, if you're just a super active person in general, all of these tissues are buffed up, and they're ready for it.
Right.
But if you don't start to work hard in your body pre-season and you throw a 60-pound pack on and hike into a camp 6 miles, and then plan on carrying a 20-pound pack, you're increasing the chances that you're going to overload something that's not ready for it. So if you push too hard, that's how stress fractures happen in a bone, for instance. If you just defy the physics of that bone, it doesn't have time, weeks and months, or maybe even longer than that, to buff itself up all the way, it will fail. And so it's all about buffing up these structures in hunting-like situations to get them ready. So that's the first thing, I think, is just carrying load in realistic situations. And I don't know, I'm not a guy that goes to the gym and trains that way. I like more, I take my bow, I go stump shoot at the same time I'm walking side hills, and I'm walking up and down hills, behind my house, just to try to use everything per normal, just like I would hunt. I don't go overdo it. I'm too lazy.
Yeah. I know you're not. You're too smart. You're the reason why my quote-unquote workout regimen is the way it is. You pointed out to me a long time ago that, Randy, if you sit at your desk, at your computer, doing tax returns for 6 or 8 months, you have not worn a pack, your feet are accustomed to just sitting on your butt, but you think on opening day elk season, you're gonna do these 10-mile hikes with a 30-pound pack, and then you wonder why your feet and your back and your knees hurt.
Things you could get away with when you're 20 that you can't when you're 30, and less at 40.
Right.
Yeah.
So that gets me to a point that I want to talk about with the person who, maybe they are a gym rat and they're just working out at the gym. They're working on everything there, but they're wearing their, tanny runners, and they're not at any load. They're always on a predictable surface. All of a sudden, they come out to Bozeman, Montana, or wherever they're going, even worse yet, central Idaho, which is steep, and they're in great shape. But they leave the trailhead, and within 3 miles, their feet, their knees, their ankles, everything is killing them because they've not, I'm assuming they've not done what you just talked about, gradually building up in preparation for these loads.
To me, from an overuse standpoint, one of the worst things you can do is do the same thing 1,000,000 times in a row. That's going to give you overuse. If you do different things 1,000,000 times in a row, you're much less likely to use the same part too many times. Okay. So like running on a flat sidewalk, if you're an overpronator, like this is a flat foot, an overpronating foot, if your foot moves the same way every single time on a flat treadmill, on a Stairmaster, all those things are good for short bursts, but I always tell people if you're going to go to the gym, do 10 different things. And it still isn't adequate because you're not in your hunting boot, you're not carrying load, but do 10 different things. Don't just sit on I love the treadmill, don't just stay on the treadmill for an hour. It might help your heart and lungs, but all you're doing is moving that foot the exact same way and your knee the exact same way every single step. And it's going to increase the chances you're going to get overload, especially if things are moving out of position. So runners, the people that run around town, for exercise, I tell them a little sidewalk, a little on the right side of the road, a little left side of the road, where the road cants, a little in the center of the road, a little on the grass, a little on the gravel. So your foot's moving differently, you're much less likely to get injuries, and you're training all those structures to handle those little differences in position. Right. And it goes all the way up to the hip, back, and knee. So nothing wrong with going to the gym, and a lot of people live in communities where it's just inopportune to get outside on a day-to-day basis, and the gym's fine, but I'd find 6 things to do, and then I wouldn't miss out on, even if you can only plug it into the weekends, getting out and walking up a side hill and throwing a pack on. Right. 20 pounds for the first week, 30 pounds and 40 pounds. If you kind of strain your body that way for even a month, it's going to start making positive changes. Things are going to get buffed up. The bones will remodel. It's called Wolff's Law of bone remodeling. The bone remodels itself based on the lines of stress that go through it. And so there's this dynamic healing of bone, and the more you use it, stronger it is. Just like people that go into space, no gravity, they get osteopenia or osteoporosis. Their bones weaken a little bit because of anti-gravity effects. So gravity strains all these structures, and the key problem then is if your structures are moving out of position, the strain can be bad. It can create itises, swelling, and pain.
What happens to our foot as we get older? I'm 56.
Still young.
Still young. All right, Bill, whatever.
I'm on the countdown. I'm 60, and I'm starting to count my remaining whitetail seasons. It's scaring me a little bit.
So This is more my foot rather than that foot.
Yep.
Is my foot going to get wider, flatter, longer?
Yep.
What's
yep.
going to happen over all the above?
Is going to do that. First of all, just based on age and changes in ligaments and tendons, there's what's called glycosylation. It's a chemical deposition that occurs that makes tendons and ligaments more brittle, maybe so more likely to rupture, less giving around as the joint's trying to move, and then there are gravitational strain related changes, like a tendon's going to stretch. In a flat foot, I always tell my patients, in general, this is a general statement, in a high arch foot over, say, from 40, 50, 60 to 70, a high arch foot may gain a shoe size.
Because as it flattens out, it
because
gets longer?
Right, because gravity's just having its way. Slowly, even a high arch foot that's nice and stable and kind of stiff and defying gravity really well because the joints are locking up and everything's being used correctly, so to speak, the foot's still going to settle out a little bit. And most people will notice in their 40s and 50s, they jump a shoe size. And people with a high arch foot, I think, may gain another half a shoe size before they hit the pine box at 90. Flat feet, 2 shoe sizes. As the rear foot's rolling in, the forefoot has to go somewhere, right? Because this can't happen without this doing something. And so it elongates. The foot elongates. Every time you over-pronate, it elongates. And then those joints have it, because they're too mobile, they have a tendency to allow themselves to be pushed out of position. So your foot can widen, it can lengthen. I mean, I think just in terms of boot fit and things like that, you got to pay attention to your true size in weight bearing. When you go to a really good boot shop or a good shoe store, they will make you let them measure your foot with those little slidey devices, standing up, and they're going to make you do that. In the old days anyway, they wouldn't let you buy shoes without, they'd force you to get measured. You could say, I'm a 9, and they'd say, let me measure you anyway. And so your foot will change that way. The arch, and so gravity wins in a flat foot. The arch will try to be lower, and the ligaments will be tighter, but joints will be further out of position, and the foot will elongate more. And
so if you used to be a size 11, and you've always said, I'm a size 11, I'm a size 11, by the time you get X number of years past that, you might be an 11 and a half or a 12.
12 or 12 and a half. In a flat foot, you're going to, I just think in my opinion, in my clinic over time, I just see that flat foot changing a lot more, which is classic. I mean, even in surgery, that we do a lot more surgery on flat feet than high arch feet because that foot changes and has more trouble.
Okay. So, like this pair kind of tracks, you got this smaller pair. I always go out to their shop here, and they make me stand in their little measuring device. They measure the length, they measure the width, and they make me walk around with the boot, with the normal sock I have, with, like, these are courtesy of Dr. Bill Wilshire. I got to pop the liners out, and I got to put my orthotic in there. And they want to know exactly how it's feeling. So I always say, if you want the best fit to your boot and the best end result, go as close to the manufacturing process as you can to get fitted, because they understand all this stuff, that how boot fit plays into this one piece of this whole foot performance and architecture.
Yeah, I mean, we've talked about it before. You spend your money on optics, scope, binoculars, and boots is 60% of the battle. That and good layers, you know. I think we're pretty lucky here with a boot company right here in town that we can do that. But there are ways to do it by standing on. These companies are set up to do things over the internet. They'll send you a piece of paper, you stand on it and trace your foot, and they know how to read into that. And then further, you can, you know, the whole focus of orthotics is to kind of, it doesn't customize the fit of the boot. There's a component of that. It's more that it can hold your foot in better position and make that boot work better for you. You know, these boots, I'm anticipating I'm going to have these in 15 years and giving my kids with new soles on them. They're so good, and they're worth every penny of $350, even though that hurts. But boy, you know, $100 hiking boot, if you're going to go take on the Idaho, you know, or parts of here too, and other places as well, it makes a huge difference. And so if you can get into, it doesn't have to be a custom boot, but these good companies are set up to make them one step closer to custom. Well, folks, appreciate Bill being here. We've got him for the whole morning
and I'm trying to get as much information out of you as possible. But we got to give the viewer a little break. I mean, you're laying down gold here. This is like, you know, we'd age ourselves by saying this is like Fleetwood Mac gold here, like, you know, and they'd be like, are you guys from the late 1970s or something?
I'm from Chicago. I can motor a little bit and get some information out there. So you probably have a lot of editing to do.
But anyhow, a lot of good stuff here. Thanks to Dr. Wilshire for joining us. We're going to do some more. Just remember that this stuff, you know, our friends, Jim and the crew out at Contractures asked us to do as much informational content as we can about feet, about everything related to foot care. And so that's why we're able to do this. If you go out to Contractures.com and you use promo code Randy when you buy your boots, they're going to give you I think it's $70 or $80 pair of mountain gaiters, the stuff you see us wearing. So thanks for being here. Got some more stuff that we're going to talk about in the next video, as long as Bill will let us keep harassing him.
Got all day.
Got all day. All right. Thanks, folks.